Right.
Hi, I'm Wally Taylor from Forum Health, Texas Integrative Medicine, where I practice environmental medicine in Austin, Texas. And today I have the great privilege of visiting with Zachary Buns. Mr. Buns is a psychotherapist and the owner of Mind States, a neurotherapy practice in Valparaiso, Indiana. He has 10 years of experience treating a variety of mental disorders, as well as working with individuals toward reaching their peak performance goals. Mr. Buns has created a proprietary system of intervention that consistently yields high success rates for many issues and limitations. His approach is eclectic and combines elements of psychodynamics, behavioral therapy, neurophysiology, neuroscience, and biomedical engineering. His practice utilizes various forms of neurofeedback and biofeedback, as well as quantitative electroencephalography, QEEG. And I met Zach recently through an introduction from Barry Bruder. Barry Bruder is the developer of a system of microcurrent neurofeedback or transcranial electrical stimulation called IASIS that Zachary was also involved in, and he's done some great educational videos for the practitioners in IASIS. And after listening to his experience, I just really wanted to get him in front of my viewers to talk a little bit about the role of microcurrent neurofeedback in as a toolkit modality for his practice, and also his experience particularly with IASIS. So Zach, it's so good to have you today. Why don't you tell us a little bit about your practice and how you got involved with IASIS?
Thank you for having me. So my practice is kind of evolved quite a bit from the time I started. So I'm a young guy. I'm not by any means like a seasoned clinician, but I've been at this to some extent for 10 years, and I've been in private practice for the last 7 years. And so I got my start as a traditional psychotherapist. Like, I was really ingrained in like the psychodynamic tradition, and that's really what helped me. I got into this because of my own experiences. Therapy changed my life, and at a pretty young age, I knew this is what I wanted to do, and the best way that I knew how to do it was to talk, the talking cure. So that's where I pursued in school, and I went to school, and things are broken down into theory and practice classes. And so my theory classes were largely becoming brain-based. The etiology of all these different things that people suffer from originate not from the mind or the individual as the problem, but the brain. And it was super interesting. I mean, it was just like some of the most fascinating classes I had, where we would understand how the brain contributes to these problems or maintains them. And then the practice side, it was what do you do about it? And you talk to it. It was like, there seemed to be this divide between, all right, the brain's the problem, but we're going to just talk to it. And then I remember seeing a video by Daniel Amen, and he was, I think it was like a TED talk. And he basically had said that every other field of medicine outside of psychiatry and psychology has evolved to look at the organ that they're treating. And if we're going to purport that the brain is the source of this stuff, why are we not looking at it? Why are we not dealing with it more directly? And it left me with a certain discontent, but I still kind of married to the idea that, this stuff works. I mean, it saved my life, and I've seen it help a lot of people. It's not like talk therapy doesn't work, but it left me with this, there's got to be more. So my postgraduate education, I think, formed me much more so than my undergrad or graduate education did, because in that process, I continued to want to learn more about the brain and ways to deal with it more directly. And I ended up, Bessel van der Kolk, he's kind of a luminary in the trauma treatment world, kind of a real pioneer, early adopter of different things. He was one of the first people really, really like studying and testing EMDR, which was, controversial for a long time, and now it's widely accepted.
Is he the author of the Body Keeps the Score?
Yeah.
It's
a great book. So I read that book, and that was my start with this stuff. Is I didn't hear a lick about neurofeedback in my education, and it was discovered largely at the University of Chicago. I mean, out in California as well. with Barry Sturman, but Joe Camilla at UFC, and I was there at University of Chicago. Why aren't we talking about this? This stuff is so cool. But so I read The Body Keeps the Score, and there was a chapter in there called Neurofeedback. And I was like, I'm not reading this chapter because I'm over reading about things that I can't do as a psychotherapist. You know, it's just you hear the word and it sounds like this thing that's going to be done in a hospital, kind of like ECT or something, you know, and so I just didn't even read it. And then I was a huge fan of Bessel van der Kolk, so I went down to Boston. He had a conference, and he spent the majority of the conference talking about neurofeedback. And then it's a way to directly work with the brain. To a lot of people's dismay, yes. You know, people were like, why is he talking so much about this? And he was excited. He was in the middle of a study working with, you know, training T4 and P4 for PTSD and T3, T4. And he was pumped. So, and I was too. You know, he kind of said, it's challenging but it's rewarding. And here's what it's doing. You know, can you do this with your voice? And I confidently said, no way. You know, I can't do that. Nowhere, not the specificity, not even the results. And so I was like enthralled, you know, so I got my start, and it's a daunting field, neurofeedback. So, you know, it's just like you type in neurofeedback and there's a million directions you can go. And so I basically contacted Bessel, and he steered me in the direction of Eager, fantastic amplitude-based neurofeedback company. And so I got their system, brought it in, and it's everything is slow going, you know, but what was really remarkable is that you put sensors on somebody's head and you change nothing about the circumstances of their life other than some of the electrical activity in their brain, and their entire experience of consciousness can change. And people come in with all of these complaints, and they also come in with meaning about those complaints, right? I can't focus. Why? Well, because my teachers are boring, and because I don't like this and that. And they're wrapped up in this meeting, largely allocating the source of their control to things outside of themselves. And then I've always had this belief, you know, through my education, I think most of my life, that my problems weren't me. I didn't want them. I had them because I lived in a brain that imposed them on me. And to be able to bring this to life through neurofeedback and say, you're okay. This isn't you. You're just living in this thing which largely dictates your experience of consciousness, and it's dysregulated. So we're going to put these sensors on, and we're going to train this down or that up. And, you know, lo and behold, they changed. And it was like, oh, and it completely altered the trajectory of my work. I thought it would be a tool in the toolkit. You know, look, I'm a psychodynamic person. I spent my education researching this stuff and learning this, and it just completely altered my trajectory. And ever since then, I've been going down this road of, you know, I really appreciate the extent to which the brain is, you know, like I say, dictates so much of our consciousness, your emotions, your feelings, your behaviors, and your sensations within your body. And so I started buying more equipment, you know, in part because you get this itch. You start thinking, well, what else is out there? If this can do this, you know, it's all these different approaches. So I got into QEEG and Z-score neurofeedback, and S-Loretta neurofeedback, and, you know, coherence and synchrony and alpha theta, all these different types of neurofeadback. And about every year I get this itch. What else is out there? You know, what else can we do? And I was going to buy Lens, which is like kind of an earlier, similar technology. It's just that, you know, Lana Oaks' stuff and IASIS is a different iteration. And so through my research, I reached out to Lens, and you know, they got me some information, but IASIS was super responsive, and they jumped all over my questions. And so my wife and I own the practice, and so we called Teresa Horab. She's a clinician in New York, and I talked to her, and she was making these claims, which seemed to be, I didn't believe them, quite frankly, because there's hype over technology. People who sell technology have hype about it, and understandably so. So I spent a lot of money. I'm a new clinician. I don't have a lot of money. And so I bought this amplitude thing, and it's like, oh my God, this is going to change the world. And I'm like, it really helps people, you know, and it's really pretty impressive. But then there's this other stuff, Z-score, live Z-score. It's going to change everything. Oh my gosh. And I bring it back to my practice, and it's like, it's a little step up, you know? And that was my experience with most everything I've brought in. You know, it's different, maybe a little better. It works differently, but nothing seems to have like the monopoly on the truth or what's most effective. If that was the case, then you'd know what it is. Everybody would know what it is. And so I was like, okay, I'm done buying equipment that doesn't live up to the hype. So I said, basically prove it. You're saying it works this fast. You're saying you get these results. How about I come out to New York and I stay with you for a couple of days, and you treat me and my wife, and I meet your clients, and I work in your clinic? And she said, for sure, come on out. And I was like, all right, well, you know, you're intriguing me. So we went out there and I was in a bad way when I got there because I got a call from Blue Cross, one of the networks I'm in, Blue Cross Blue Shield, and they said, oh, we're going to be auditing, your practice. It's just a standard thing, it's just the ACA, some risk management stuff, and I thought, oh my gosh, this is like my 500 patients or something, and it turned out to be one, but I didn't know that, so I was like, oh man, and then we were negotiating some other deals that I didn't think were going to go through. And I was like, let's go home. I don't even want to be here, but I went in, of course, and I wasn't that dramatic. And I'm used to a very engaged process of neurofeedback where you sit down, you've got your sensors on, okay, we're starting, focus, the clinician stops talking, and the client engages very intimately with a screen that's revealing activity in their brain. And there's this kind of learning process, a non-conscious learning process that happens that involves a lot of attention to the screen. So Teresa's hooking me up and talking to me. And while she's hooking me up and moving these electrodes around, I am feeling this relief that I could only liken really to a spiritual kind of experience, and which I'm not unfamiliar with. I've had times in my life where I've been in a lot of distress, and then a wave of relief comes over me. And the only way that I've really been able to conceptualize that is that there's something larger than me happening, and that's cool. And I don't really overthink it. And it's like, thank you, whatever this is in the universe, And then I didn't realize that she was actively going through and treating me. I thought she was taking some measurements or some baselines. And at the end, she said, how are you feeling? And pretty, actually fine. And Samantha, she wasn't nearly as stressed out as I was. She was like, more, it'll be fine. But she had a similar experience. She felt nothing until the last site fair. And then she was just smiling and didn't know why. And we went out to dinner that night, and we both felt great. And it started to creep in the next day, some of my stress about these other things. But it was powerful, and I think that's all I needed. The anecdote is powerful, and I was like, I'm sold. But we did stay, and we worked with her patients, and they were all super articulate about their experiences with IASIS, and even little kids, they're 10, 12 years old. The way they talk about their changes, it's like, this is for real. So we went home and tried to do the responsible thing and think about it for a week, and we lasted about 2 days, and we made our order. We bought a device, and we brought it in.
Great. Well, I know you've got a lot of experience with some of these other modalities and working with the QEEG diagnostic portion of this, and I know in our talks together that you've described this a lot. But why don't you talk a little bit about some of the major differences between the kind of looking at the screen, learning type feedback associated with the diagnostic tool of the QEEG, and how that differs from what you're able to do with IASIS.
Okay. Most everything out there in the neurofeedback world, it's a similar. There's a common thread, and that's that there's a learning happening through operant conditioning, and so you're going to pair a brain behavior with a reward, and you combine those two together, and you can shape behavior. We do this all the time in life. We go to work and we get a paycheck, and it feels good. We got the paycheck. I get to pay my bills. I get to go on a vacation. This is very cool. I'm going back to work, and I work, and they say, awesome job working. Here's your money, right? And it's just like this, it shapes my behavior and what I do. That's how it works with my employees. They keep coming, but they won't keep coming if I stop giving them the reward. And so the reward shapes what they do. And this is the idea with neurofeedback, is that the brain may be stuck, but it's not a static organ. It's super dynamic. So when you look at a brain, to the extent that you can, with say like a QEEG in real time analysis, it's constantly changing. So the normal, based on a database, what would be normal would be 0 standard deviations, right? But the brain will maybe shoot up to 2, 3, 4, 5 away from what would be normal, and then it goes maybe -1, -2, and it has this tremendous range. It's just that what the QEEG reveals is that it's averaging in an area that I would consider an outside of a functional range. It's kind of just like way out here. And so traditional neurofeedback works by identifying, what do we want to accomplish here? And we try to set some kind of parameter. So I use myself as an example for this, is that for most of my life, I struggled pretty considerably with ADHD. And when I look at my brain map, I got my first map. It was my frontal lobe was just covered in theta. And theta is a slow, sleepy, kind of deactivated brainwave state. And the frontal lobe is largely the executive of the brain, planning, organization, motivation, impulse control, things I struggled with. And so the way that it's going to work is that the sensors you put on the head with traditional neurofeedback, and they monitor that brain activity. So we'll say the power of that theta is this hand here, and it's doing this. It's too high. There's too much of it. I would feel better if it was down here, but my brain's not going down here. So what I have to do is raise a certain threshold in the computer. This is the computer, this is my brain. And whenever my brain passes the threshold in the computer, I'm given feedback. So that might be a simple beep. My brain might be amplitude, the power of that sleepy, foggy brainwave. It falls down below the threshold that the computer is looking for, and it goes beep, and it comes up here. And it goes beep, 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 beep. And it pairs a certain brain behavior, a reduction in theta at a specific part of my brain with the reward. And when the brain is given feedback about its own self, it's able to reorganize itself. Just like if you went to a party and everybody, this is the example I like to use, everybody says, hey, Wally, what's going on, man? Looking right at your eyes. And they look down at your shirt for a second and they say, yeah, cool. You know, and hey, Wally, what's going on? And they look down at your shirt and they look back up at you. At some point, you'd be like, what is going on here? Right? And so what would you do if that was the case? If everybody's looking down at your shirt, what would you end up doing?
You'd want to see what's on my shirt.
Yeah, right. You'd want feedback.
Something wrong.
Yes, you go to the bathroom and you look in the mirror, and the mirror would tell you exactly what's wrong. It would be the spinach from your salad earlier, a little bit fell earlier. You take it off. With that feedback, you made the adjustment, and now nobody looks at you funny, right? And that's nice. And we're always getting feedback. You know, if I touch my hot lamp, it hurts me, I pull away, I'm better for it. Life, we're all shaped by the feedback we get, right? I'm wearing this shirt in part because I've gotten okay feedback over the years, right? But I don't wear shirts with spikes shooting out of them everywhere. Maybe I wouldn't get good feedback. I hold my face like this, not like this, because in part, I wouldn't get good feedback, right? So, you know, feedback shapes so much of what we do. It's just that the brain doesn't get feedback, right? You can't, you know, you can't see into it. And so, you know, people, I'll say, nobody complains about excess 4 to 8 hertz activity amplitude in their frontal lobe or anterior cingulate. Nobody complains about that, but they do complain about ADHD. And nobody complains about excess 20 to 30 hertz in the posterior, but they complain about anxiety. Nobody complains about alpha asymmetries frontally, but they do complain of depression, right? And so these things, there's all of these kind of correlates that relate to what's going on in here. But the ability to actually provide feedback to that kind of, you know, I guess reveal aspects of the mind as they relate to the brain, that's what this can do. And you can provide feedback directly to the brain and not have to go through the individual to make that change. And so rather than learning how to cope and compensate, which is what predominates in the field of, you know, most disorders, is you have to learn how to deal with what you've got. But what if you can actually change it? And that's what neurofeedback is about. So you provide feedback to it, and you can shape its behavior in a way that will last and endure. And so it's great. I mean, that's how what I just showed you was like an amplitude neurofeedback. The amplitude drops, you get some feedback. Usually you're shaping behavior in a more purposeful way. You know, you're gonna reduce something like an anxious kind of uptight brainwave like high beta, and you're gonna try to also reduce something spacey like I had like theta. Then you're gonna try to reward something else that's consistent with your goals. Like maybe for me, I wanted better focus, so I rewarded like 12 to 15 hertz activity, like a low beta. And that made me feel really, helped me a lot. And it works really well. And that's the basic principle for even Z-score neurofeedback. You know, you're just finding different aspects of the brain's function. When they do what you want them to do, you give the brain some feedback.
And you can actually even look at that QEEG and get a visual interpretation of what's going on with those waves so that you can see how that feedback's actually playing out visually.
Totally. It's so cool to be able to show somebody their brain map and to say, look, yeah, of course you have these symptoms. You know, how could you not, right? It's amazing that you're even doing as well as you're doing. You must be an incredibly strong person. But life is going to get easier if we can get your brain working better. You don't have to fight so hard against your brain. There's what you want and what your brain wants. Your brain doesn't care about you. You know, your brain's just doing what it does. And there's a certain part of your brain that allows you to be who you want to be in regards to whatever symptom you're talking about with focus. Well, I need this guy to work well. It's not working well. Doesn't matter how bad I want it to. The question is it in the condition to allow me to do it? And so when you can look at the map and you can see that there's these deviations in that way, it's very helpful beyond the diagnostic or the treatment planning perspective, because it lets people kind of a window into their mind. Why am I like this? And people will make meaning. I'm like this because perhaps I'm bad. I'm flawed. I'm damaged. I'm fundamentally unacceptable. I'm unlovable. These are the things that people come in with all the time. And then to be able to say, hey, no, it's not you, it's your brain. It's like, well, that's neat. But then when you can show them a picture of their brain, right, that's reference to a database of what we expected of their age, and say, look how different this is. This is the brainwave. This is where it's at. My goodness, of course you've got this going on. This is really consistent with your symptoms. And so even from that perspective, the QEG is remarkably valuable. But just to show somebody that, you just see sometimes tension, like, oh, it just clicks. Oh my gosh. I was with parents earlier today. I did a review session, and their little girl is this, she's like a sweet girl, but man, can she rage. And she's super unfocused. And it's so frustrating for the parents, and it's frustrating for the little girl. And part of this review process, I spend an hour and a half with people when I review their maps, because a large part of it is going over how to understand what this is. And then it's like, oh, your little girl here, the medial prefrontal area is like asleep, right? There's 3 standard deviations excess of delta. And then there's 3 standard deviations of theta all through here. And there's all this high beta back here and no alpha. And you teach them what this means. And it's like, you have a wonderful little girl. It's just that she's living in this brain, which is pretty dysregulated. And the nice thing is it's totally plastic. The brain can change, we know that for sure. And here's how we can do it. Let's do it, and it's just so like, oh my gosh, this isn't so about me. The little girl thinks that her anger and her aggression, she comes up with a story, right? She makes meaning about her anger. And that meaning is that my mom is bad. My dad is bad, right? The king and queen of her universe get elected to be the enemy. But perhaps that negative energy, that anger or aggression isn't about them at all. It's about her brain. And when I can help this little girl, 9 years old, understand that, it's like, oh my gosh, right? It opens up the door for a different type of relationship, and then a different type of way of caring for her own self, and her family, which is just remarkable. And that's something that the Q does well beyond the purposes of where am I going to put my electrodes and what am I going to try to accomplish. But that's the big purpose that people use Q for, is where am I going to put electrodes? Because with traditional neurofeedback, you have to know where you're putting your electrodes and what are you trying to accomplish. And that matters a lot, because if I came over there and I put an electrode right here on your the right side of your frontal lobe and kicked up high beta, you would be really anxious over time. You would start to feel miserable, anxious. Or if I increased alpha left frontally, you would probably become depressed. Right? Or we increase theta frontally, you might feel spacey and foggy and just kind of disorganized. So you have to know exactly what you're doing with traditional neurofeedback.
So you can actually train the brain to have maybe worse outcomes and behaviors if you're not careful with this kind of modality.
With traditional neurofeedback, you can absolutely do that. There's just story after story. There's this big contention in the field. Should this technology be available to anybody? Right? Because it's kind of likened to personal training. You have this organ, you want to train it. You can do that with your muscle. You just do this with some weights. And so there's this kind of battle, in a sense, with should it be more of a, given to the professionals, or should it be opened up to the lay people? And it's, people aren't super clear about it. But I think I think this stuff is life-changing, and it would be, to the extent that it can be made available to more people, is great, but not if there's going to be a significant risk for harm. Because if you don't know what you're doing, and you could totally inadvertently train yourself in the wrong direction. And I know colleagues have done that for sure, just to kind of see what happens. And one of my colleagues trained his high beta up and in the back of his head, and he was like skipping words and sentences, or frontally he did it. He was skipping words, and he's jittery and he couldn't sleep. And you can totally drive the brain. Now, it might not stay there, because if it results in more inefficiency, generally the person's not going to want to continue doing it if they're getting worse and worse. But some people are so desperate that they're like, I'll weather any storm I need to, right? And that's where you can really train the brain to be more deviant, I guess more pathological in some way, and you can cause harm. And that's one of the reasons why I like to use QEEG, because it lets you know to a reasonable certainty. It's not like it's an exact science, but it's probably better than guessing. It lets you know, where should we look, right? What where is the deviation occurring in the brain? And is that deviation consistent with your symptoms? And so, right, well, lots of different disorders relate to different regions or networks within the brain, and you want to be able to pair the symptoms to the networks or the regions and say, okay, yeah, there is dysregulation in this network, in this brain region. And what is the deviation? Oh, well, it's an excess of fast or slow or idling activity. And is that also consistent with what we're seeing? And if we check mark yes for those boxes, then we can say, okay, let's make a protocol. But that doesn't even mean that's correct, because you could do everything right, train the brain in theory the right direction. Somebody who's ADHD, reduce their theta, and that doesn't mean they're better off. Most of the time it does, but it's not exact science like that. If it was that clear, that cut and dry, everybody would be doing it, you know, and it's more challenging than that. There's more trial and error than that. And so it's really, traditional neurofeedback is about driving the brain, trying to teach it to go somewhere different than it's currently at. It's about normalization, you know, or it's about increasing or decreasing arousal. So I'm too under aroused, let's kick it up. I'm over aroused, let's lower it. Or from the QEEG perspective, let's make it more normal. Not necessarily normal, like, you know, the goal isn't to make somebody have a 98.6 degree temperature. It's just, you want to be within the functional range there. You can be a little high, a little low, but that doesn't necessarily mean that direction is good for everybody. And this is why neurofeedback is challenging, because you don't know exactly what the brain needs. We're guessing. We don't even know, quite frankly, what EEG totally is. We're listening to these vibrations in there, and we don't know, the field doesn't totally know the EDL, you know, how it originates and where it's coming from and why. And you know, it's very much like we're listening to an engine. You know, I have like a headset I put on, and it's like a stethoscope, and it has a piece of metal on the end of it. And so when I'm working on an engine, I can put it on different parts, and I can hear how it vibrates, right? And those vibrations can kind of let me know what's going on. And a really skilled mechanic can listen to an engine and say, you know what, it sounds like you got this cylinder misfire going on, or something like that. And that's what we're doing, is we're listening to the vibration, and we're saying, yeah, vibrations like this usually mean this. But you know, we're poking around at the most sophisticated thing in the known universe. You know, we don't really know at the end of the day. We just have good guesses and some research, and it seems to work pretty well. But I'm pretty clear with folks that we don't really know.
And then how do we transition to talk about what the difference is when we switch over and go with this cranial electrical stimulation that we get with microcurrent neurofeedback?
Right. So hopefully now you get a sense that traditional neurofeedback is about the clinician knows what's best, kind of, right? So we're making the plan. We're saying we should drive you over here. We should bring you over here. And so really normalization to some extent is what we're looking for. And the big picture as we zoom out isn't just normalization, it's flexibility. It's a brain that can access the right state at the right time. That right now, in order for you to focus on me, it's not about do you want to. It's about, can you suppress some theta and activate some low beta, and that's what really allows you to do it, to suppress your default mode network and your central exec, get that rolling for you, and your salience network can orient you properly. Like that's what's going to make that happen. And so with traditional, you know, we need to know to some extent, where are we going, what are we doing, and trying to drive it to be more flexible, to get it out of where it's stuck. With IASIS, one of the neat things is that you don't have to necessarily know where to take the brain, because IASIS isn't about a purposeful driving of the brain one direction or the other. It's really about getting it to not do what it's presently doing, right? So we can surmise that if somebody's coming into your office with significant symptomology, that their brain is likely kind of stuck in some way. And we don't know necessarily without a cue, but if the technology we're using isn't you know, relying on the clinician to make change or program the software to make a concrete change, if what we're doing is putting a sensor on that stimulates the brain to do something other than what it's currently doing. And that's kind of what LIPTIS is doing, or IASIS is doing, is low intensity pulses, transcranial electrical stem. It's saying, okay, here's what you're doing right now. Here's your dominant frequency. This is what the brain keeps firing away at. And so let's give a little stim over here, and a little stim over here, and a little over here, and a little over here. And it's just trying to tell the brain, you keep doing this thing, man. Try this, try this, try this. And it allows the brain to try something other than what it's doing. But the brain doesn't just, you know, reinvent itself. It needs a nudge sometimes. Like I said, your brain doesn't care about you. You care about it, but it doesn't. There's no evidence that it actually cares about you, right? It's just non-conscious, just massive cells turning on and off, and so it's happy to go about having pathology forever. put some external influence on it and it will change. But it doesn't just, it's like a car. The car doesn't fix itself. Your car doesn't say, oh God, it's horrible having this O2 sensor out. No, it will complain. It will get in your way because your car's not working right, or your lights are flashing, and then you fix it. Right? And this is the idea. And so the brain is totally pliable, but when we can just kind of stimulate it around wherever it's stuck, it tends to get it to just be more flexible. And that's what the name of the game is. It's not about me having less theta. It's not about me having more low beta with ADHD. It's about me having flexibility, because that theta is good. I'm going to bed at night, or I want to be deeply creative. I need that theta. So it's not like it's a bad brainwave. It's just, do I have it at the right time? And that's what IAS is about just trying to restore flexibility in the brain so that the person can get into the right state at the right time. If that's sleep or concentration, or there's times where we need to feel anxious. Can we get into that state, right? All these states are adaptive at the right time, but the brain gets stuck and we feel one state too much, over others. And so that's the big difference with IASIS is that it's I guess more about optimization rather than normalization. And that's
Did you find that you liked that one term that they threw out? Was it modeling diversity, or what was the term?
Modeling flexibility.
Modeling flexibility.
Yeah, Mish Lamarche. I think that's how you say her last name. Yeah, I was doing my webinar, and she popped in there and said, it looks like you're modeling flexibility, because we're looking at a frequency spectrum, 0 to 60 hertz brain activity at a certain site, and we're seeing the brain dance around, and that's good, but the way in which it's dancing may not be the right dance. That might not be, synced up with the song, right? The environment is the song and the brain is a dancer. And if they're out of sync with one another, they're not resonant with one another, then there's problems, right? And so there's a different dance that the brain can attune to it, but it has to hear, right? And in order for the brain to hear, it has to be open and flexible. It can't be too rigidly, like I only know the waltz. Well, then I'm only going to do the waltz. It doesn't matter what the song is, right? And that's where symptoms arise. It's when we're doing the waltz when we should be doing some other dance. I don't know dance, but it's something else. So yeah, it's about showing the brain what this flexibility is. Tom Kalura, he's the president of Brainmaster Technologies, which is a super cool neurofeedback QEEG company. And he talks about the concentration relaxation cycle a lot, that in order to be flexible human beings, we have to be able to engage in concentration, these beta brain waves, and get the job done, focus narrowly, and then pull out into the bigger picture of theta and alpha. And we need to be able to go in and out, in and out. And some studies that he talks about with pilots reveal that the top-notch fighter pilots, they have that flexibility. They can get into the concentrated brainwave state, and then they can get out into a relaxed state, in and out. They kind of get out of this alpha afterwards, kind of helps consolidate what they did, and they come back in. The so-so pilots would stay in the concentrated state, and they'd burn out. They'd be inaccurate. They'd miss things. And it's about this flexibility, with no matter what we're trying to do, whether it's, me using talk psychotherapy, EMDR, AVE, CES, lifestyle stuff, better nutrition. It's all about flexibility, having the brain be able to get in and out of the right state at the right time. And IASIS does a great job with that.
So let's talk for a minute about practicality in terms of outcomes, if you compare these two modalities, and then also whether there's any difference in terms of the ideal candidates for the one versus the other.
Oh yeah. So the practical outcomes side, we'll start with that. The thing that seems to respond best is people, this is my experience, so I want to be clear at this point too, that I've been doing other forms of neurofeedback for 5 years. I've been doing IASIS for 7 months, or 8 months or so. But what appears to respond best in my practice is people who are over aroused, which is a lot of people, right? Like, we are a revved up people, right? We're go, 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 productivity, more. We're anxious. Watch the news. It doesn't matter if you're left or you're right. Everybody's angry. Everybody's upset. They're yelling. Oh, they're tight. And they're in this beta. This is just like the world we live in, right? I drove over here today and I got honked at like 3 times for just driving. It's just, this is the world we live in, and we're all scared. Right now we got COVID. People are upset and they're scared and they're frightened, and this increases this sympathetic nervous system arousal, this fight or flight. We got to try to do something about this. And if we can't do something, perhaps we'll fall into like a freeze response. But a lot of people are just walking around with this tension, you can just see it. They're upset. And those are the folks who seem to respond best to IASIS. You can almost see it in the session. Somebody's sitting in there, and I've had so many people where you hear about the placebo effect, right? Like you believe something will happen and your brain can make it happen for you. But there's I was recently hearing about somebody talk about the nocebo effect, where if you believe it's not going to help you, maybe it won't help you. Like a lot of psychiatrists I know won't prescribe their medications unless the patient believes it'll help them. If they believe it won't, there's a good chance it actually won't work. And I've seen this time and time again with IASIS, where people come in and they come in with a story. They always come in with a story, why are you upset? They never just say it's my beta activity. They have a story. They have to accommodate it, right? It's elected an issue to be the problem today. And so, all right, let's put these sensors on. Let's do our session, and then let's talk about it. Now, I don't want to talk now. This is not about my brain, right? This is about this issue. And all right, well, let's do it this way. Let's try. And I put the sensors on, and they want to resist it, and they can't. You see their shoulders soften, their jaws soften. You see beta activity that's actually electromyogram activity, it's muscle activity, kind of fade out. As you look at anything above like 25, you get somebody in your chair who's tense, and there's just all of this activity in the frequency or in the spectral analysis. And then it just slows, quiets down within maybe minutes. And those folks, it's just remarkable for the over-aroused folks, anxiety, panic, aggression, rage, anger, those kind of things, an angry type of depression. The folks who are already chill, maybe too chill, and they're kind of spaced out and they're foggy and they're tired, and those folks don't respond as quickly. They seem to respond a little bit later. Mingjian Wang, some of his research shows that it looks like perhaps IASIS for a little bit increases slow wave activity, which would make sense for these people who are revved up, that they would then come down for a little while. And the slow people might feel even a little more slow. They might feel a little spacey for a bit, almost too relaxed at times. So that seems to be like the ideal candidate is somebody who seems to be really revved up. Not that it doesn't work for folks who are a little bit more on the lower end of the spectrum, like they have too much parasympathetic, and there's kind of like lack of urgency, just whatever. Those folks, we haven't had the kind of success we've had with the revved up folks. Whereas with like autism, we don't have a whole lot of success. It's been a lot longer of a road, more sessions than I would suspect for somebody who's got some anxiety or some mild ADHD or something like that. But yeah, IASIS for the revved up folks, oh my gosh, man, it's just phenomenal. I forget, you asked me two questions, and now I'm not remembering the first part of the last question you asked me.
Well, in terms of how it stacks up, not so much which patient might benefit the most, but is it a more efficient process? Does it end up being faster or cost less? What are some differences in that realm?
Okay, sure. So with IASIS, generally we see some kind of symptomatic improvement within 3 sessions. Most people, before they even get out of the chair for their first session, they're feeling a positive shift. A lot of times it's hard to describe because you're changing these nuanced aspects of brain function, and people might not be used to that, and so they don't know how to ascribe language to it. And so you hear things like a shift or an opening or a lightening or something's different, I don't know, and you say, is it positive? They say, I think so. But there's this kind of something is happening. Some people will, like I had this one woman I'm working with who's been doing traditional with me for about 6 months and twice a week. And she was having a really bad episode. I mean, it was like a 10 out of 10. And when people say I'm at a 10 out of 10 depression, a lot of times I think, is it really as bad as I could possibly get? Do you really want to be dead right now? And it's like, for sure she did. She was slouched. She could barely hold herself up on my couch. And her first IASIS session, within about 15 minutes, she was down at a 2. And I said, that's about as happy as you could possibly be, that you've ever been in your life. And she's like, she's feeling that, she's embodying that. So that's an outlier. I wouldn't want anybody hearing this to think, oh my gosh, I'm going to go buy IASIS now because Zach Burns said that you can take depression from a 10 to a 2. But that happened. And I've seen that happen time and time again with people. But more than anything, within those first few sessions, you get a positive effect of some kind. And then in order to create enduring changes, it appears that you got to get, at least 10, but probably more like 20 or 30 sessions in. With traditional neurofeedback, usually I tell people that we want to see something positive within the first 10 sessions, and that 10 session mark. Whereas with IASIS, I tell people 3. So there's a big difference there. And then for a real remediation, like I did about 100 sessions of amplitude-based neurofeedback on my theta to bring me from 3 standard deviations of theta, or 3.5, down to about 1.5, or 1.5, something like that. And that's where it's at now, and I like it. But it took 100 sessions, right? And so that's $10,000 if you're paying $100 a session. So it's a lot of treatment, and it's a slow moving process. Now I bought into it 100%. I'm like, this works. I own the equipment too, so that helps. But I really bought into it. But when you tell people about this technology, they're intrigued, but they're skeptical, as they should be, right? And I think it's good to have a healthy amount of skepticism about this stuff. But one of the things I think about IASIS that I value so much is that now everybody coming into my practice starts with IASIS. That wasn't my plan when I bought it, but that's the way it's gone. And so everybody starts for twofold, because what I've come to understand is that people will complete a successful round of treatment with it very quickly, 20 sessions or so, and not that they couldn't get better after that, but that they're happy with where they're at. They're like, wow, that was worth the money I just paid for that, as opposed to I'm starting to get an effect at that point. But the other thing why I really value IASIS at the outset over traditional neurofeedback in its various forms is because of how quickly it instills hope in people that what I'm saying is true, that I do a significant amount of onboarding. So when I talk about my proprietary approach, I've created a system where we go through and we talk about, who are you and why do you have your problems, right? What role does your brain have in your consciousness? Those kind of things. I've just structured it in a way, I stand on the shoulders of giants. It's not like I'm the guy, but I've organized it in a way where I really try to help people understand that they're good, that if it was up to them, they wouldn't have their symptoms, that they have their symptoms because there's nothing, not because there's anything wrong with who they are, but because of the brain they live in, that their brain is like their car. Right? The driver is to the car like you are to your brain. You have willpower, you can direct it, but only if the brain's in a condition to allow you to direct it the way you want. And that's a cool theory, right? To tell somebody this, and it's like you start the potential of breaking up some shame. That why you've not been able to fulfill your goals, to be who you want to be as successful as you want to be. It doesn't relate to some core aspect of who you are or being a failure or anything like that. And many times, not even because of your environment, but rather your brain. And it's empowering because you can change your brain. You can't change the political climate. You can't change this person's religion or where they're from or whatever issues people have with people. You can't change that. Most people, you say, why are you frustrated? They'll tell you a story about somebody else being the cause of their misery. And it's somebody that they have very little control over. But when you can bring it back to them, and not just them as this nebulous entity, but as their brain, and say, we can change your brain and make you feel better. And that's like a very cool concept. But with traditional neurofeedback, I can prove it to you, but you got to invest maybe like 30, 40, 50 sessions. But with IASIS, it's about, a lot of times one session, and they feel this shift. They sense this change in their consciousness, whether that's in their sensations, their perceptions, their emotions, their cognitions, their behaviors, and ultimately their identity, right? They feel differently about who they are. And who Wally Taylor is right now is about what condition is your brain in. But if we dramatically change the condition of your brain, we got a different Wally Taylor in front of us, right? If you had 6 shots of whiskey during this call, there would be a different Wally Taylor in front of me right now, right? That who you are is largely a reflection of what is the condition of the vessel that you live in. And so to change that in a healthy direction, make it more flexible, let people know that it's possible to change your life, and you can do that by changing your brain. And man, IASIS does a great job. And that's one of the reasons why I really prefer to start people with IASIS. Now, sometimes people plateau with IASIS, or they're not making the gains as you would expect. And so I'll bring in other stuff. I'll bring in my Z-score, neurofeedback, things like that. And you can really purposely drive the brain. There's some peak performance applications that I'll use traditional neurofeedback for over IASIS, because I want to drive the brain to do something different than it's currently doing in a specific way. So, a large part of my practice is not just about working with people who are mentally ill, but what happens in my practice is that, we say, we kind of live in this world where there's this imaginary dichotomy between mental illness and mental wellness, where, the APA got together and they said, this is the threshold by which you're mentally ill. If you don't have this many symptoms, you don't qualify for the diagnosis, right? So we say mentally ill, mentally well, and here's the threshold. And so people get to this point, they move down the continuum of performance and health, and they get to this point where they say, well, can I keep going? Right? And this is what you'll run into with IASIS or whatever, is people buy a package of 20, they do the 20 and they feel better. But then they're going to ask themselves this question, can I feel even better? And the answer is yes, likely so, right? And so we start moving into peak performance. And at that level, at some point, a lot of times for those folks, we'll switch over to a traditional neurofeedback, whether that to be work on deep states, putting somebody into a really deep state of consciousness to help kind of program aspects of their subconscious, or really try to help somebody cultivate a certain state. So I got into this niche of working with traders, and they have to be able to focus really intimately on a trend in the market, and then pull out and reference their own sense of what is the best setup, what is the best trade here, and then zoom back in and zoom out. And that's, being able to help people identify, what does this state feel like? What does this state feel like? How can I get into that and out of that? And that's where traditional excels over IASIS in that way. But I use them both. They complement one another for sure. Over cost-wise, you're almost always going to be cheaper with IASIS, because what 20 sessions of IASIS can do in every way has outperformed what I can do with 20 sessions of Z-score, Loretta, amplitude, whatever. I mean, it almost gives somebody a bigger change for those kind of initial sessions. The end result will be the same. You'll have a flexible brain. You'll feel better. The process of getting there is very different, and it's been cheaper in my world with IASIS as opposed to with traditional, because I charge the same amount for both of them.
Now, I'm curious, this may not be something that you can answer, or hard to say, but since, I deal with people that obviously have a lot of mood disorder symptoms and cognitive symptoms, but a lot of my patients have other corporal symptoms, body symptoms, whether it might be aches and pains or digestion or muscle weakness or exercise intolerance. But I'm just curious, what's been your experience with some of the way people respond other than just their mood and cognitive? Have you seen anything coming through on that in your experience?
So, I draw out this trajectory for folks when I say, okay, why are you the way you are? Right? And people will generally make meaning, and they'll look out of themselves, out into the environment to try to make meaning. My family, where I'm from, all of these kind of things. And so I try to bring it back to the individual. Say, like, your brain is at the base of this thing. You take your brain out and you're gone. Your brain is kind of the CPU at the foundation, and it gives rise to sensation. How do you feel within your body, right? In all these different ways, good, bad, pain, not, lack of pain, pleasure, relaxation, tension. And then that will give rise to, on some level, your emotion, right? If you tense up your muscles in your jaw and you hold it for 5 minutes, you'll probably start to feel anxiety or anger, right? And so it's like this sensation leads up into some emotion, and that emotion into cognition, our ideas, our attitudes, our beliefs, the content of our thoughts, and then up into what we're going to do, our behavior. And as that persists for long enough, it informs your identity, who you are. Say, who are you? What are you all about? You'll go back down and you'll reference those 4 things: what you do, what you don't do, what you believe, what you don't believe, your emotions, how you feel about stuff, how you feel in your body. We kind of take inventory of the content of our consciousness. And so people have a directive. They say, I'll kind of put all this stuff on the screen, right? Brain, sensation, emotion, cognition, behavior. I'll say the mind, and then the individual. I'll say, all right, what are you looking for with this, right? People come to see me that one of those 4 things they want benefit from. They want benefits from the way they feel in their body, the way they feel emotionally, how they think, or how they behave. And so we make goals. So we know if we're getting closer to our goals, we don't want to not have goals. So we set goals, and then we set off on a course of treatment, which never involves just IASIS. I'll say that. I always do more lifestyle stuff and things like that. But we do that, and they inevitably, no, I shouldn't say inevitably, but generally they reach their goals or they get better. But you can't isolate any kind of effect like this if your level of engagement is the brain. If you engage with the emotions, then you'll change the emotions. If you engage with the thinking, you'll create a discrete change within a certain aspect of thinking. I get anxious when I go to the grocery store and I have to stand in line and people want to talk to me. So we can work on that specific aspect of your life. But that problem isn't a grocery store problem. It's a problem that your brain doesn't allow you to be in the right state to feel comfortable. So if we intervene there and we change the brain, it's impossible not to also then change sensation and the other emotions and the other thoughts and the other behaviors and the other pieces of yourself that you consider to be your identity. So it's like you create these global shifts, even though you're targeting specific things. Because if you're dealing with the brain controls everything. And so, I had a woman whose right arm has been numb for the last 3 years, and she's been to all kinds of docs trying to figure it out, and she's picked up some diagnoses, and I don't dispute them. It's beyond my scope of practice to treat somebody's numb arm, so I don't treat that. But within a few sessions, the numbness is gone, and she was my first patient with IASIS, and it's still gone. And the doctor said it's a spontaneous recovery. It's not due to IASIS, right? It's a spontaneous recovery. It's gone. And this is the case all the time with people with TBIs and stuff. As a mental health guy, I can't treat migraines or I can't treat chronic pain or anything like that. I'd like to hire somebody that will allow us to do that. But there's all these improvements in those facets of somebody's physiology or within their body that I don't know how to target. But they do seem to be like a peripheral benefit of treatment. That I've had people who have had just their jaw has been so tight, clenching their jaws for years, grinding their teeth, and it's gone. This woman's tongue was numb as well, and it's gone. There's nothing there. She's got full sensation back. Her hands, we've done temperature biofeedback, like peripheral biofeedback training over the time I've worked with her, and you put a sensor on your hand and you learn how to warm up your periphery. You kind of relax that vascular system, allow some blood flow to go out. That's consistent with parasympathetic arousal. And never could she budge above like 78 degrees. It's just always there. And it was frustrating for her. We tried a million things and it was just she was just getting this like learned helplessness with it. So all right, we'll scrap that for now. We did IASIS and this was before COVID was really, we shook hands and I was like, oh my gosh, your hands are warmer than mine. And mine are always like 93. And we hooked her up and like 96 degrees. It's just like, we didn't have to work on that.
The brain is the great controller, right, of all these other things.
Totally.
Quite amazing.
Totally.
Well, this has been really enlightening. I appreciate your experience and sharing it with us from your unique perspective and having dealt with all of these different tools in the toolbox. But do you have any parting thoughts that you'd like to share with me and our viewers?
Yeah, something that popped into my head was that, IASIS, traditional, anything, they're all just tools in the toolkit. Nothing has the monopoly on what's most effective, and the technology, I really purposely kind of think that I never hitch myself to one technology. This is my thing, this is it forever. Because as time goes by, there's this kind of process of growth where a discovery happens. There's this rapid growth and it kind of levels out. Right? And there's this rapid growth and it levels out. And I'm sure that's going to be the case for all of this stuff. And that none of these technologies are going to make you excellent. I think one of my big, as I talk about the benefits and the changes that people experience, IASIS seem to be a really big key ingredient. But we cannot forget that we're working on the brain, and the brain is not just this thing in a vacuum. It does relate to the environment, right? And the environment affects it in return. And so where we expose ourselves, what we expose ourselves to, what we eat, our hydration, our sleep, our exercise, our light exposure, the psychological factors of our life, our environmental factors, our social factors, spiritual, religious, and all these things really have a huge impact. And so the results that I get in my practice are not just because of me using one technology. If that was the case, everybody would be really successful and everybody would hear about this. And so I use it as part of a larger intervention where, it's like, I say like IASIS is like tuning up the brain. But if we're going to go to a car analogy and I'm the best tuner in the world, I can't tune away a clogged air filter. I can't tune away bad gas, sludgy oil. We got to make sure that the brain has the resources it needs to go about its business. And this is why a part of my treatment always involves lifestyle modification. And I was like, you got to be hydrated. If you're not hydrated, you'll never get better. You'll only temporarily cope with something and your benefits will wash away. So I always help people do that. And so as people think about incorporating IASIS or neurofeedback into their practice, understand that it's not a magic bullet. It isn't. It is. I've never seen anything like IASIS. Like I said earlier, amplitude, Z-score, Loretta, yes. And then in terms of immediacy of effect and how potent that effect is, IASIS is like up here, right? Boom, boom, boom. And then blown away. I mean, I bought I bought IASIS and I was doing about 40 to 50 neurofeedback clients a week. And within 3 weeks of bringing it in, we were at 90 people, 90 plus people. And that was all, we've never marketed either. I mean, it's all word of mouth. Outside of a Psychology Today listing, that's all we've done. And it was all basically, can my other kid do this, right? Or can my husband do this? Or can I do this? Something like that. So it's really awesome. But I want nobody to think that they can just go buy a box and that's the only thing they do and likely create the changes that I'm talking about. Maybe, but I don't believe that's not. I think we got to treat the whole person, in a more kind of a holistic way than just one thing.
Well, those are great thoughts and great concepts, and I appreciate very much you taking the time today to share all these with us.
Absolutely. This has been so fun. I'll have to do it again sometime.
You bet. Have a great day.
Thank you. You too.